So when we first heard that you could get a stroke certification for a skilled nursing facility, it was a big goal of ours at Lake Country. Because we have physiatry services, we wanted to provide the best care that we could for our residents. So I brought the idea to Holly and the North Shore team, and it's something we decided to pursue because we're always looking at different ways to increase the quality of care and use evidence-based medicine to give our residents the best chance for success.
The certification process started with the idea, of course, and then taking a look at the requirements of the program to see if that we could actually meet the requirements of the program. There were some tweaks that we had to make with the AHA to make sure that we can meet their requirements.
I was very excited. It was a great opportunity to look at showcasing our skills, our abilities, and another great opportunity to offer to the community here in Oconomowoc.
It was really exciting. It's such an opportunity to have here and something that I enjoy working with the clients and seeing them progress and go home.
The initial thought was it would be really exciting to find something that Lake Country could specialize in. The great staff and great team that we have here, I think it was a really good opportunity for us to kind of shine.
So any kind of certification or process or program that you're building, it's going to take a village to do within a skilled nursing facility because there's so many moving pieces and everybody's so busy, right? So there's a lot of different things that need to happen. We need to coordinate interdisciplinary meetings. We need to figure out what the goals are of our program and what each person and individual is going to do. So we had to designate different program champions throughout the facility that were going to take specific tasks and be able to carry those through.
We get the families a lot more involved. We get to do hands-on training more with the families, including, car transfers, like what to expect going home.
It's really being able to look at a great service that is needed in the community, looking at why strokes might occur, who might be impacting from strokes, and what we can really do to improve their quality of life.
So we developed the program essentially from scratch since we were the first facility in Wisconsin to have it. All of the protocols that we're using were designed by myself and the entire North Shore team.
Went through the trainings to identify the types of strokes, things that we could do, and then our nursing team set up some clinics for the nurses as far as blood pressure parameters, different things, notifications, things like that.
The American Heart Association credentialing process really helped us look at, all of that clinical information and being able to put that to all of our nurses in a really unified way.
I think the one headline is that you will get great quality care if you're here and you have a stroke. We have put things in place such as the physiatry medicine, the oversight, the additional training for our staff, additional training for the patient and for their caregivers. Those things are in place to make sure that they have a successful transition in this new phase of their life, because it is a big deal. It's life-changing for a lot of people.
Our goal is to provide as close as we can the acute level care in a rehab facility in a skilled nursing facility. So that means the patient is being seen by a board certified physiatrist or one of our providers on our team. That patient has the therapy available, right? They have the equipment and DME that they need. They're able to get things like AFOs, bracing, management of pain medications, antispasmodic medications. They're able to really get that level of care with the PM&R oversight that they may not get at a different facility.
To be on the team of the first accredited American Heart Association team in Wisconsin is just beyond exciting. To really be able to take the knowledge and the leadership that Holly and Dr. Calling and our team has done and to really drive that forward, to really look at improving outcomes in our community and in our state is just wonderful.
So when we got our final certification for the stroke rehab here in Wisconsin, it was an amazing feeling. It was just an accomplishment, something that we're looking forward to, like starting really hitting hard and going forward with.
I think anytime that you work really hard on something and it comes to fruition, it is something that you should be proud of. So I'm very proud of the facility and the place that I work. Specifically proud of this certification because it just means that we stand out from other facilities, and we're always looking for how can we be better and like what is our kind of niche in the community. And I think it is a very underserved population. It'd be really good for our community to have a stroke program in the area.